Good evening, Tan Sri Praveen from the Malaysian Insight. Tan Sri, you may have said this before, but several experts, including the former Deputy Director General of Health, Dr. Lokman Hakim, has questioned the logic behind the latest CMCO, calling it drastic and outrageous. Even the Academy of Medicine of Malaysia also want Putrajaya to lift the CMCO. They said that other states don't report high daily cases. So your comment on this?
Now, before the start of this pandemic, COVID-19, there's two schools of thoughts, and we always embrace the two schools of thought. At that point of time, we do not know whether whatever we do is right or wrong. The first school of thought is mainly that, we use the herd immunity approach. And these are all the experts, public health experts are talking about it. So herd immunity approach means that the more the public get infected, especially the young ones, and then they will provide, they will build antibody, and that will provide a herd immunity. But the risk is to the vulnerable population, the elderly, and etc. So this is one concept. But we in Malaysia, we embrace the prevention and control, meaning to prevent individuals to be infected. So that is a concept. So again, only a concept, but we are not sure which concept is right or wrong, right? So, but having gone through for the last 10 months, then we can see today that the country that actually use prevention and control method, the cases are more contained and managed well as compared to those who embrace herd immunity. A few countries, Sweden is one of them, and this is the issues. Then, so this is a two school of thought, but history will judge us, and on the hindsight, we know which approach is better in terms of to contain the infection, because this is a new virus. Every day brings new knowledge and lesson for us. So when we look into now, in terms of prevention and control, there are two approaches. How do we look into prevention and the control? So again, we use the public health intervention and public health measures. This is very important because we do not have effective medicine or even vaccine for the time being. So if we do not have the vaccine and effective medicine, then our activities or our management is to prevent individual to get infected. So because of that, so you need to look into how to prevent the infection. So one very important is that to prevent infection, we started with the border control, international border control. Those coming in, we make sure that we screen them, and once we screen them, quarantine them for 14 days. That's one. Second, you look into border control. Recently, PRN Sabah, for example, there are cases coming in, returnees from Sabah. So there's also positive cases. And once there are positive cases, we quarantine them. But we also did the testing for those coming back for Sabah, and whether they go to Labuan or even to Kuching. So this is again, but the question now is, in Semenanjung, do we have border control, interstate border control or not? Do we have interstate, inter-district border control? So red zone, for example, someone from red zone, from Sabah coming to Semenanjung, we have a border control in terms of testing, and if it's positive, then we isolate them. But can we afford to do this in Selangor, for example? Those people coming in and out. So again, for us to do the public health intervention, we'll have to look into the risk assessment of each state, each locality. But we know that in Semenanjung, because of the density is very high, mobility is very high. So this is the challenge that we have. So for us to take action, quick action in terms of prevention, if it's localized to one kampung, if we localize to one mukim, it's much easier. Like in second wave, localized to Kampung Baru, localized to Pasar Borong, so we can do our activity, tempo that region. Now that when we look into the cases now, in Semenanjung, they are widespread. So it's not confined to one area. And when we started in terms of CMCO in Selangor, there was a lot of objection as well. But there was a proactive, preemptive action that we have taken, despite the objection that we have. And today you see, in terms of the cases, if we have not put on, implemented the CMCO earlier, the scenario will be worse than, perhaps worse than Sabah. So this is one you have seen now today. the data is showing us that in Selangor, because of the density, because of the mobility, and also because of the distribution of the cases, not only in one area, but well distributed in the states, and also involves Klang Valley. So now, I think we are also looking at Negeri Sembilan. And for example, I'll give you a few cases. In Selangor, for example, if they travel to Johor, they travel from Melaka, then they spread the infection there. And the cases, recently there's one of you have asked me, one of the cases went back to Kelantan, and then then they spread among the family members, etc. So what we are doing now, we are looking into a risk assessment because the virus is already in the community. The virus is not localized in one area. The virus is already infecting the workplace, factories, even private hospitals and public hospitals, and etc. So, and the sporadic cases that we see is about 50% of the whole in terms of the infection. And more importantly is that we have to take preemptive or even proactive action now, not to wait and once you wait and then wait until the district become a red zone, then you take action. That is too late. So now, if we can take a proactive measures like what we did for Selangor, for 2 weeks we can contain the infection. That's one. Second, the green states will also enhance in terms of protect the green states, protect the green district, protect the green mukim, and protect the green kampung, and also the family. So this is an initiation that we have. At the end of the day, we are not going to end the infection. We are going to control, better control, before the flare-up of the infection to 4 figures and become a wildfire. It's much difficult to control. Now it's a burning ember. If it's a burning ember, we can localize and then we can control it better. So we ask for, if all of us can comply 100% to the SOP or stay at home, we don't need the MCO, we don't need the CMCO, but the enforcement now. So everyone has mentioned last couple of weeks, for example, we need enforcement. So now we are enhancing the enforcement. So they hope that in 3 weeks, in 2 weeks, we can actually bring down the cases. So in the second wave, if you look into the second wave, it took 3 months to control the infection. But now we are giving 3 weeks for us, whether we are able to achieve that. So this is a big challenge for us. And the third wave is much challenging than the second wave. But certainly we are more well prepared in terms of knowledge, in terms of our preparation to handle this COVID-19. So we hope for the best and we prepare for the worst, but we hope for the best. So this is why we are doing the preemptive and proactive action. And again, none of us in this country, whether it's a private sector or public sector, have any experience whatsoever to handle a pandemic, including the public health expert in the private sector. So again, but we have an experience of 10 months and also we are learning from our neighbor countries. There is no benchmark in managing pandemic, though we are creating benchmark because many countries are learning from us in terms of how we handle the second wave, for example. And this shows that we are creating the benchmark, and hopefully the actions that we have taken will be the role model for other countries to follow. Thank you.